If you're dealing with flaking, redness, irritation on your scalp or your face, you're not alone. Hi everyone, I'm Dr. Aleksandra Brown. I'm a board-certified dermatologist and welcome back to my channel. Today we're going to be talking about seborrheic dermatitis, what it is, why it happens, how to manage it with derm-approved treatments. So if you're into derm-approved treatments, skincare, beauty tips, make sure you like, comment, and subscribe for more. What is seborrheic dermatitis? Seborrheic dermatitis, or also known as dandruff, is a common inflammatory skin condition that causes redness, greasy scaling, and dandruff-like flakes. It often affects areas with more oil glands like the scalp, eyebrows, sides of the nose, behind the ears, in the ears, sometimes even the chest. It is not caused by poor hygiene. Rather, it's a combination of genetics, oil production, and overgrowth of yeast on the skin, which we're all born with. Some symptoms you might notice are things like flaky, greasy scales on the scalp, eyebrows, sides of the nose, sometimes even in the ears. There's often redness and irritation associated. Some may experience even itching or burning sensation. I find that it tends to get worse in cold, dry weather, and the most common trigger factor is stress. So why do we get seborrheic dermatitis? While the exact cause isn't fully understood, seborrheic dermatitis is believed to be triggered by things like overgrowth of Malassezia yeast. This yeast is naturally found in our scalp. We're all born with it, but some of us are more sensitive to it, and it can trigger inflammation when there's too much oil or when there's a moist environment, such as when you're sleeping with your wet hair. Another thing that contributes to seborrheic dermatitis is excess oil production. The more oil your skin produces, the more food Malassezia has to thrive on. This is a perfect example with teenagers. When the hormones kick in and their skin gets oily, so does their scalp. They often develop itchy, greasy, scaly scalp, and even acne around the forehead or the hairline. Another reason that we get this is weakened skin barrier. So if you have a compromised barrier, that makes the skin more prone to irritation and flaking. There's also a component of genetics and immune response. So some people are just simply more prone to seborrheic dermatitis due to their genetic factors. I am one of those people. I suffer from seborrheic dermatitis, so I will give you my tips as we go through this video. Also, triggers like weather, stress, and harsh products can also contribute to this. If you've ever been really stressed out at work, home, or you've lost some sleep, have you noticed that your scalp gets itchier? Yes, stress plays a huge role in this. Things like cold, dry air, stress, irritating skincare can all make it worse. So what can you do to help improve this? And keep in mind, I said help improve, not get rid of, because we're born with the yeast, and if you're sensitive to it, you're just going to be sensitive to it. But I'm going to give you tips that are going to help you feel like you don't have this at all. Number one treatment are the medicated shampoos for the scalp. If seborrheic dermatitis affects your scalp, using medicated shampoo with antifungal and sometimes even exfoliating ingredients is going to be the key. Also, if you have breakouts on your face, or if you're a man and you happen to be growing out your beard and it gets itchy in the winter months, you can and should use your anti-dandruff shampoo on your face, especially if it contains selenium sulfide, pyrithione zinc, and ketoconazole. Those three active ingredients minimize the amount of yeast buildup, so you can certainly use these as your face wash, beard wash, chest wash if you get it on your chest. Just don't get the shampoo in your eyes. So let me give you some recommendations on best OTC shampoos you can use for scaly, flaky scalp, face, nose, beard, ears, all of the above. It's really not going to come down to a brand name. It's going to come down to active ingredient. And you've heard me say this over and over and over again. You need to know not what's on the front of the bottle, but what's on the back of the bottle. Read the active ingredients. So first shampoo recommendation here is Nizoral. That's the brand name. On the back of the bottle, you're looking for ketoconazole active ingredient. This comes in 1% over the counter. You can also get it as 2% from your family doctor or dermatologist. This is a powerful antifungal that reduces the amount of Malassezia overgrowth. If you get this over the counter, check out my hair care video as well, because I recently did a video on what I use in the shower, and this shampoo lives rent-free in my shower. I love how it feels, I love how it smells, I love everything about it. Another thing to remember, if you have really, really curly hair, some of these shampoos can be drying. So making sure that you're using your anti-dandruff shampoo on your scalp and not so much on the actual hair is very important. I will make sure I lather my scalp really good with the shampoo, but I'm really not worried about getting anti-dandruff shampoo on my ends. Definitely check out my hair care video for more tips on how I actually use anti-dandruff shampoo, how often, which ones I use. I'm going to go ahead and link it up here. The next shampoo I'm going to recommend is going to contain selenium sulfide. So if you go to your drugstore, you look for Head and Shoulders, you want the blue bottle. This is not your white bottle, okay? The white bottle Head and Shoulders contains pyrithione zinc. It's fine. It's not my favorite. I have it in the shower. But the blue bottle Head and Shoulders, that's the good stuff. That one contains selenium sulfide 1%. This is very powerful antifungal, also great for beard and chest if you break out anywhere else. It helps control the flaking and scalp buildup. Your next anti-dandruff shampoo is going to be Perithione zinc containing anti-dandruff shampoo. So this is all your white head and shoulders, or actually my preference here is the CeraVe anti-dandruff shampoo. It has perithione zinc, but it also has ceramides. It's hydrating and antifungal properties, so it'll get rid of the flakes and treat your skin barrier. It's 2-in-1, also has 0 fragrance. I also featured the shampoo in my hair care video, so make sure you check it out because my daughter and I both use this one. Now, if you don't have a lot of inflammation and you just have flakes in your scalp and you have very oily scalp, adding in an antifungal with salicylic acid is so important. Salicylic acid is an active ingredient that helps exfoliate the top layer of the scalp, so it will eliminate any flakes and dead skin cells that you have. Perfect example here is Neutrogena salicylic acid shampoo with 3% salicylic acid. And if you check out my hair care, you'll see that I have, gosh, I don't remember, maybe 4 or 5 anti-dandruff shampoos in my shower. And yes, I use all of them because they all have a different active ingredient and they leave my scalp feeling just a little bit differently. I always recommend using medicated shampoo at least 2 to 3 times per week. It's important to leave it on your scalp for about 3 to 5 minutes before you rinse it off. If you're somebody who doesn't wash their hair every day or every other day, or if you've gone longer in between and you feel like your scalp is really oily, consider using a regular shampoo first to remove any oil and residue from the scalp, and then doing a second shampoo with the anti-dandruff shampoo to allow the shampoo to actually work. After you rinse your anti-dandruff shampoo, you can and should apply conditioner, but make sure you apply the conditioner just on the ends, not all the way to the scalp, because applying conditioner on the scalp can contribute to the oil buildup and make it too greasy too fast, and then you really are perpetuating the cycle of yeast overgrowth. If your dandruff is severe or you have itch, there are leave-in treatments with perithione zinc or even sulfur. Delacruz sulfur ointment has 10% sulfur. This is a spot treatment for seborrheic dermatitis patches that you can use on your face or your scalp. And one thing you can do to help improve your seborrheic dermatitis, dandruff, and really help minimize the oiliness and flakiness on the scalp is dry your roots. After getting out of the shower, if you sleep with wet hair or go with wet hair for a prolonged period of time, the moisture from the wet hair and heat from your body are perfect, moist, hot environment for that yeast overgrowth, and then your scalp just looks really oily. So dry your roots, use your anti-dandruff shampoo, and let me know in the comments how that works out for you. Try it for like 2 weeks. Also, don't forget to moisturize and protect your skin barrier. Seborrheic dermatitis isn't just about flaking, it's also about skin barrier health. So using the right moisturizers and soothing treatments can help reduce inflammation and prevent flare-ups. Your best option here for face and body, I love La Roche-Posay Lipicar Balm AP Plus Cream. Comes in a nice pump, perfect for face and body. Vanity Cream and CeraVe moisturizing creams are other brands. They're really good that you can use on your face and your body. They all contain ceramides and niacinamide to help repair the skin barrier. If none of this is working, Athlete's Foot Cream over the counter will help. I know it sounds gross taking Athlete's Foot Cream and applying it to your face, but they work and they're just as effective as the prescription antifungal treatments. And speaking of prescription treatments, if you were to see your dermatologist, we offer prescription strength ketoconazole cream and shampoo. These are going to be a little bit more effective than your over-the-counter shampoo. We also have topical steroids. These are not long-term solution. Topical steroids are only used really in the scalp temporarily to relieve the severe inflammation and itch. For face, we offer topical calcineurin inhibitors. These are things like pimecrolimus or Elidel or tacrolimus or Protopic. These can be used on a long-term basis on the face if needed for severe seborrheic dermatitis. In my patients who are severely immune compromised or under major stressful events, I will sometimes offer an oral antifungal such as fluconazole just to kind of bridge them to that clear skin, and then offer topical maintenance, whether it's prescription or over the counter, to maintain things. So remember, seborrheic dermatitis can be frustrating, but if you know what's happening, if you know why your scalp is greasy, oily, and how to properly treat it, and as long as you understand you're going to be managing this and not curing it, it can be under control. I suffer from this, and I don't feel like I do. I personally have to wash my hair every other day. If I skip a day, or if I leave my hair wet for several hours after washing, it does get worse. So use your medicated shampoo. Over-the-counter shampoos work really well. Make sure you have at least 2 active ingredient medicated over-the-counter shampoos in your shower that you can alternate so yeast doesn't get used to one and you keep it at bay. And most important, make sure you dry your roots after you wash your hair, or really you're just not doing anything. If your hair is wet, the yeast is just going to come right back. The shampoo that works for one person might not work for another, so trying them and figuring out what works for you will be the best. And remember, you're going to need to maintain this. If you found these tips helpful, don't forget to like and subscribe. You can also find me on Instagram and TikTok at Dr. Aleksandra Brown. Thanks for watching. I'll see you next time.